Welcome back to the Ricky Matthews Show from the Citizens Bank studio. Listen, I want to tell you, I'm thrilled to continue these conversations with Singing River Health Talk. So far, we've talked about colon health. We've talked about health in women's world and how to avoid some serious issues along the way and how to be extremely preventative in the way you approach yourself and your own health. And we've talked about pain management. We did that last week, and that was a terrific conversation. In fact, it was originally scheduled to be a half-hour conversation because of a problem with one of the guests we had. We were able to take that for an hour, and it was a great conversation because people are focused on managing pain today. And in the world of opioids, that's not where they want to go. They want to manage in different ways. And we had a long, terrific conversation about that. Today, we're going to talk about urology and health in that respect. And listen, I'm a 67-year-old male. For regular listeners, you know this. I work really, really hard to take care of myself, running, weights, the whole 9 yards for over 40 years. And I watch my numbers. PSA, for example, extremely important. I've had a couple of brother-in-laws who have had cancer. A really good friend of mine that had a very high PSA, had issues surrounding that. And he did not have cancer, but he still had to have major surgery. So I watch it closely. It's something you have to do, but that's not the only thing you need to look for. But that's what we're going to talk about today. And so without any further ado, I want to bring in Dr. William Hughes. He's a board-certified urologist. He performs surgical procedures at Singing River Gulfport, but he's also part of the Urology Associates in Gulfport. And he's got a terrific background, which I look forward to telling you about. So without any further ado, Dr. Hughes, I appreciate you joining me today.
Oh, thank you, Ricky. I'm happy to be here, and I'm happy to talk about men's health and tell you some of the exciting new things we're doing here in Gulfport with Urology Associates and with Singing River. I think it's a really blossoming time for urology here.
Well, look, you know what's interesting, as I mentioned at the very beginning of the show, one of the things that in conversations with your administrator and other hospital administrators, one of the things that we're learning is that in order to stay relevant, in order to be literally on the edge of the best possible patient care, is technology is playing a tremendous role. And when I look back at the work that you did, your preparation, the things that you're doing today, technology is a huge part of that, isn't it?
It is, absolutely. I think it's twofold in medicine. It's maintaining your knowledge base because, of course, every year our knowledge base grows, and that's why physicians undergo recertifications at certain intervals. But it's also adapting to newer technologies. Look, there's a lot of old urologists in this country, and there's a lot of urologists that never trained in robotic surgery. Those surgeons do incredible surgeries. They do them through slightly larger incisions. They have very comparable outcomes in terms of cancer control and postoperative complications. But the value of being more recently trained is just being more exposed to the most recent technological advances. And they allow us, hopefully, to gain, minor or major improvements in long-term outcomes for patients, side effect profiles, and just being able to offer patients a variety of treatment options.
Yeah, I mean, it's a lot of focus these days on less evasive surgeries so that people won't have the long recovery periods that used to be there, and in some cases maybe still are there. And that's it's been a kind of a steady part of the conversation with all the folks that I've been talking to at Singing River Health System. Listen, you went to the University of Georgia, and you also went to University of Georgia Medical School. You actually ultimately came back to Tulane. But are you from Georgia originally?
Yes, sir. I grew up in Georgia. I did all my education there prior to residency training. Tulane residency training was 5 years long. I love New Orleans. I didn't want to leave. I think everybody who lives in New Orleans probably regrets leaving to some degree, but the value of Gulfport is it's an hour and 10 minutes away.
Yeah, listen, I was a former publisher of the Times-Picayune and president of Nolan Media Group. I know that area extremely well. I lived in the Warehouse District. Loved that place, like you can't imagine. And we're part of the Gulf region. We're an extension of New Orleans. That's why after Hurricane Katrina, it was so important for them to recover, because we wouldn't recover until they recovered. We had to recover together. And it's an important story about the symbiotic relationship we have. The culture there is undeniable, and that's the thing that connects you, that's for sure. Great experience. So, hey, by the way, what part of Georgia did you grow up in?
I grew up in Peachtree City, Georgia. It's a suburb of the Atlanta metro area, southwest of Atlanta.
Yeah, well, that's cool. When I was publisher of the newspaper here, I had responsibilities for the newspapers in Macon and Columbus, Georgia. So I spent a lot of time in that part of the country, and you love it there. Love being there, and love the people there. What's interesting about your undergraduate degree, you actually got an undergraduate degree in genetics and biology. How often do you pull on that?
Occasionally, it's to some degree, college education for physicians is a means to an end to get to the medical degree. But, we do a lot of advanced prostate cancer management now, and there's definitely a role for genetic testing and, genetic counseling and helping patients understand, what their family members' risks are of developing diseases that they've experienced. So definitely it has added some value.
You know what I've noticed? I've had in doing this show, I've been doing this show for 5 years. I retired back in 2016. I'm doing this show, and what I've noticed over 1,400 conversations that I've had is that the role AI plays, it becomes more a part of the conversation. And it's never been more true than in your world, has it?
No, I think there's truth in that. AI is an interesting subject. I think we're hearing a lot more about it lately. And it's being implemented or at least tested in some fields of medicine. So you think about, some of the fields of medicine that AI plays well to. I think about pathology, radiology, right? You've got physicians whose job is to review images of patients' bodies, to review slides, section slides from patients' bodies. And, they're testing to see if artificial intelligence programs can accurately identify and diagnose treatments or diagnose problems, diagnose cancers. Can they differentiate squamous cell and, urothelial carcinoma? And, I think that we're heading in that way. Now, can this all be done without any supervision? I don't know if that will ever be the case, but I think that every physician probably is looking over their shoulder a little bit, wondering how AI is coming for them. I will tell you right now, I think the best value for AI in medicine is with artificial intelligence scribing. So if I can stand in a patient's room and talk to them for 10 minutes about their problem, and my phone can record the conversation and generate a note that I can review, I can spend more time talking to that patient, answering their questions, than if I have to go manually type up that note or hire somebody to come and listen to the conversation and type the note. So I do think AI will add value to medicine. And I think overall surgeons are probably more protected than anybody just because anatomical variation is so great. It's hard for me to imagine a robot being able to perform a surgeon's job. But you never know. We'll see what happens in 15 to 20 years.
I spent a lot of time over the past year studying AI, using it a lot. And the way you talked about using it, I think is literally going to happen. And what it will also do is probably give you some prompts back to say, did you think about exploring this? I mean, it could be a teaching tool as well to kind of keep you on your, it will literally come back and say, doctor, why didn't you ask this question? Or maybe you should explore this. Or it's just I see it as a tool that doctors can use to be more thorough, to take less of a leap of faith, to really zero in on what we know and have that knowledge base available to you. I think it's going to be terrific, but you're still going to have the doctor there. There's no doubt about that in my view. Hey, listen, you have a very unique distinction, actually. You did aqua ablation therapy, the first in Mississippi for that matter. What is that?
Yeah, so aquablation is a newer surgical procedure done in the operating room for men with enlarged prostates. It's not a treatment for prostate cancer, although I will be happy to kind of dig a little bit into the differences between those two. Some patients have enlarged prostate and prostate cancer, but it is one of the newest and, in my opinion, most exciting treatments available for men with enlarged prostates because it is very versatile and it is able to preserve sexual function for men in a way that many other procedures are not. And so when we think about treating any medical condition, obviously the things that patients always are curious or want to understand is what are the risks. And I think when you talk about risk, you have to consider that there are always risks in life. There are risks to doing nothing, right? There are risks to taking medications for 15 to 20 years. You said you're 67 years old, I believe. I wouldn't be surprised if you've taken an alpha blocker medication like Flomax. Many men your age have, and if you haven't, I'm sure your friends have.
I'm lucky. I'm lucky. Yeah.
Yeah. So the point is, when we talk about, BPH and large prostate, which I'm sure we'll dig a little bit more into, there are risks on every side. There are risks with doing nothing. There are risks with long-term medications. There's risk with surgery. And I find the surgical risks tend to just be a little bit more acutely presentable.
We'll pick it up right there when we get back on the other side as we continue our conversation. This is Singing River Health Talk, and we're visiting with Dr. William Hughes today. We'll see you after this break. Welcome back to the Ricky Matthews Show from the Citizens Bank Studio. This is Singing River Health Talk, and we're having a second visit. We had Dr. William Hughes on some time ago, and he's back today as we zero in on Prostate Cancer Awareness Month. The last time we visited, incidentally, we talked about where he came from, his great education. He actually had completed general surgery internship and urology residency at Tulane University in New Orleans, for a matter of fact. And one of the things that really stuck out from our last conversation when we were talking about treating not just prostate cancer, but just in general, the level of sophistication, the use of technology, robotics, the level of precision. In fact, Dr. Hughes, I had, as I mentioned before we went to break, I had on my show last week, Dr. Brad Greenfield, who's head of radiation oncology. And I was really blown away, actually, by how precise the radiation can be, so that all this additional injury that used to come from getting radiation treatment has been reduced dramatically. But the state of the art, both on the surgery side and on the radiation side, is really compelling these days, isn't it?
It is. And, most patients who come in to talk about prostate cancer have known someone who has been diagnosed and been treated. And a lot of times their opinions about what treatment they may want is highly biased on the experiences of their family members or friends, right? So I hear all the time, my father had radiation 20 years ago. It was, he developed complications. He was miserable. Well, the radiation treatments 20 years ago are nothing like what's being done today. The technology is better. Everything is more precise. And truthfully, the same is true about surgery. Robotic surgical tools, which have been in existence for 20 years and continue to get, modifications and upgrades. Everything is getting better. It's allowing for more precise treatment, whether that's surgery or radiation. And, truthfully, many patients will end up needing potentially both surgery and radiation. So, there is a role for both treatments in certain patients with high risk disease.
Yeah, what was interesting about what Dr. Greenfield said is that once they pinpoint where they want it to go, that if the organ moves or the body moves during the radiation treatment, it will literally stay where they are intending it to go. But the way he talked about it was just incredible. And the other point is, and you and I chatted about this last time we talked, but the fact that Singing River Health System has made the investments in the equipment that enables you to do that level of precision. And, you have to, I would say tens of millions of dollars of investment in capital that's required to keep doctors like you and Dr. Greenfield on board while you stay on that cutting edge. That's really important, isn't it?
It is, and it's true. All three Singing River hospitals have had robotic surgical instruments for decades, longer than at least a decade, longer than I have been practicing here, obviously. And our group, Urology Associates, has multiple providers in Harrison County and in Jackson County that are doing, very high risk and complex urologic surgical procedures. We got Dr. Spencer, Dr. Lyle, Dr. Coate, and myself all offering robotics. So, for a long time, many patients felt that if they needed their prostate surgery done, or if they needed a kidney surgery, if they wanted robotics, they'd have to leave the community. And that just isn't true and hasn't been true for a long time.
Hey, so we're coming to the end. Let's do two things. Hormone therapy is an opportunity to be able to slow the growth. We haven't talked about that. And then I want you to kind of make your case to the men and the women who are listening who care for their men. Make your case for why it's important for us to pay attention during September during Prostate Cancer Awareness Month.
All right. Just to hit on hormones quickly, we call them hormone therapies. Really what they are hormone blocking therapies. So many of the treatments for advanced prostate cancer revolve around blocking testosterone production or testosterone signaling. And when we talk about this to patients, we equate it to menopause, which is a similar process in women when they lose their estrogen as a result of the changes in their body, right? So in prostate cancer patients, it's not a natural change. It's a change that is induced with medicine, or in the old days, surgery, and they would castrate patients to remove their testosterone source, which doesn't have to be done anymore, thankfully. But those drugs are really reserved for higher risk patients, patients with disease that has spread outside of the prostate, or high risk localized patients that are going on for radiation.
Okay. And then make your case.
All right. So what I would say to all men listening out there is, if you are nervous about going to the urologist because you're afraid of the rectal exam, guess what? We don't have to do it. Anytime you go to the doctor's office, you can refuse anything. And I have some patients that do. Well, we have other tools. We have PSA, we have MRI, we have ultimately biopsies. If you're nervous about having your biopsy done while you're awake, we can put you to sleep. I mean, I want you to not be afraid to come talk to me. So we can skip all the stuff you don't want to do. We can still get a good assessment. And at the end of the day, you should be screened for prostate cancer. Your primary care doctor is probably already doing this, but what you should understand is if you are at least 50 years old, you should be getting a PSA blood test at least once every 2 years. There are different guidelines by different associations. The AUA says every 2 years for your average risk patient. If you are African American, if you have a strong family history, a brother or a father or a grandfather with prostate cancer, you should start screening at age 40. And you should really have some discussion with a urologist about your risk and additional screening tools. If you've got a strong family history of cancers, there are many different reasons. You don't have to have an elevated PSA to come talk to me about prostate cancer. I'd be happy to sit with you and explain, risk and screening protocols, because the PSA is just the first step, and we can do so much better than that for our patients.
It's been a pleasure to circle back with you, Dr. William Hughes. I've really enjoyed checking in with you today, and thank you for joining me.
Thank you. Everybody man up. Go get screened.
For sure. This has been Singing River Health Talk. Have a great day. We'll see you tomorrow.